Okay, so I'm going to explain how to administer an ear medication. So the first thing I would do is I would enter the room and I'd provide patient privacy by closing the curtain. And then I would introduce myself. Hi, I'm Christine. I'm the student nurse that's going to be giving you your ear medication today. And then I would perform hand hygiene, wash my hands with soap and water, and then I would ask the patient their name and their date of birth. What's your name and date of birth?
Lindsay, and July 10th, 1991.
And then I would double check with her armband to make sure that it's correct. Perfect. And then I would go ahead and perform an assessment to get a baseline, and this would include vitals to see if there's any changes after the medication's been given. And I would also determine her level of consciousness and assess her understanding of the medication that I'm about to give to her. And then I would proceed to ask whether the patient has any discomfort or hearing impairment in one or both ears. And I would ask her if she has any allergies to latex or any other medications. Do you have any allergies to medications or latex?
No, I don't think so.
No? Perfect. And then I would go and check the accuracy of the MAR with the healthcare provider's written medication order to make sure that they are the same. And then I would get the medication that's going to be given to her in her ear, and I would check it twice against the MAR to make sure that it is correct, and then I would check it a third time right before I give it to her at her bedside. So when you're checking the medication, you want to check the expiration date as well, and you want to be mindful of and follow the 6 rights of medication administration. So make sure you have the right client, the right medication, the right dose, the right route, the right time, and the right documentation. And in this case, you want to make sure you have the right ear as well. So this one, her left ear is affected, so I'll be administering the medication into that ear. And so next, before I give the medication, I'm going to raise the bed up and lower the handrail so I can access her better. And if the client has any drainage coming out of her ears, then I would be sure to put on gloves. Otherwise, gloves wouldn't be necessary. And if it's not contraindicated, then I would get the client to roll onto her right side, since that's her unaffected side, and so her affected ear is going to be facing towards the ceiling. And if this is contraindicated and she can't roll onto her side, then I would get the client to sit into a chair or on the side of the bed, and then she can use her hand to support her head while I administer the medication that way. And right before I give the medication here, I would also do a third check to make sure that this is the right medication, check it against the MAR, and make sure the medication is also at room temperature. So before I give the medication as well, I'm going to look in her ear and see if there's any drainage, and if there is, then I'm just going to take a cotton-tipped swab and clean that out, making sure not to go too deep into the ear. And then getting the medication, I'm going to hold the dropper, or actually I'm going to pull her pinna up and back to straighten her ear canal, and then take the dropper, hold it about 1 centimeter from the ear, making sure not to touch it, and then put the required number of drops into her ear there. And so after I've administered the drops, I'm going to ask the client to stay on your side for just a couple minutes, and then I'm just going to take my finger and massage her tragus and make sure that the medication goes down into her ear canal there. And if it's ordered, if the doctor's ordered it, you can put a cotton ball into the outer portion of her ear canal, making sure not to get it in there too far. And this just prevents any leakage or drainage that happens if the client moves around. So after you've done that, you're going to dispose of any used supplies and your gloves, and you're going to ask the client if there's anything you can do for her or how she's feeling. And if everything's good, then you're going to lower the bed and raise the handrail and perform hand hygiene, so wash your hands again. And then you want to document the medication you've given on the MAR and in what ear that you put the medication in. So, and if you did put a cotton ball in her ear, then you want to make sure that you come back 15 minutes later to remove it. And during this time period, while you're documenting in the MAR and when you come back to remove the cotton swab, just observe and determine whether the expected outcomes have been achieved or if any adverse side effects have happened. And that is everything.